Good morning. Today at Cancerix, we have with us Dr. Alok Tiwari. Dr. Alok Tiwari is a surgical oncologist at Fortis Hospitals, Gurgaon. Today, he's going to be talking to us about life after breast cancer surgery. Over to you, Dr. Tiwari.
Hi friends, today we are going to discuss about the what you can expect after breast cancer surgery. At present in the breast cancer surgeries we are commonly doing two type of operation. One is complete removal of breast with axillary tissue lymph nodes that we call as modified radical mastectomy or in short forms MRM. And secondly we are conserving the breast that we call as the BCS or breast conserving surgeries. And also for the axillary dissection, there is some methods by which we are preserving the axillary lymphatic tissue by the sentinel lymph node biopsy. So in all these surgeries, post-operative recovery is little bit different according to the surgical plan. So what most commonly happen after post-operative period? In the post-operative period, when you awake after the surgery, normal patients have little bit confusion due to anesthesia and little bit you can have pain sensation, but in most of the good centers a good pain care team is there. So post-operative, immediate post-operative period surgical recovery is quite smooth. You will be awake after just surgery finishing, and most of the people will be patients are orally allowed after 4 to 6 hours after the surgery according to their post-operative anesthesia plan. Then in the second day you may have little bit pain, and for that painkillers are provided. In most of these are the clean surgeries, so in post-operative period no antibiotic is normally advised in good centers. You have drains, that is we put some kind of suction drains so that can decrease the chances of collection of fluid that we call seroma inside the flap, and these drains last for nearly 7 to 10 days, and most of the patient has can take care of these drains at home. And you have to just measure every day how much amount of fluid is coming out of the drain, and normally in our center when there is less than 30 ml for 2 to 3 days we remove these drains. In post-operative periods you will be taught about the exercises. Most of the patients start doing shoulder exercises on the first day of post-operative period. Most of the patients start normal walking, on the same day of surgery or next day after surgery. Most of the patients are not catheterized in these surgeries, so they can walk and they can go washroom by themselves. And patients are discharged on the day 2 after surgery. At the home care, we give you a proper chart how you have to maintain the fluid output. You will be taught properly about the care of shoulder exercises, and you have to keep your normal life that you were doing or taking care of yourself before surgery. You can do all those things after surgery. Most of the patient we tell it, if they have undergone for axillary lymph node dissection, then they should avoid pricking or blood pressure monitoring in the same side of the arm which side surgery has been done. After 15, normally when the drain is removed after 10 or 12 days after surgery, if you have dissolver, most of the good center now using dissolver subcuticular stitches, so you don't require stitch removal. Stitches are automatically resolved. You can take bath after discharge, and you have to do your regular life, maintain your regular lifestyle. If you develop lymphedema or that is swelling in your arms, then you should consult with your doctors. In initial phases of lymphedema, simple exercises, some precautions can prevent lymphedema development. But if there is more higher severity of lymphedema, then you may be advised for the physiotherapy, or you can be advised from the subsurgical intervention. That will depend upon the grade and severity of lymphedema. So if you are getting some adjuvant treatment like chemotherapy, radiation therapy, just complete that course as